If you're over 60 and notice things are not as firm or fast as they used to be, the place you fix it is not the pharmacy. It's your shower. Could 3 minutes under warm water really change what's happening below the belt? You'd be surprised how many men rebuild lasting hardness while the water's running. This is not a pill. It's a 3-minute habit you can do every day without telling anyone. I'll show you the exact routine a urologist uses with his older patients, but first, why it works. Stay with me. I'll explain the one movement that matters and how to do it safely. If you ignore pelvic muscle fitness, erections weaken over time. You can also get more leaks, more night trips to the bathroom, and more frustration in the bedroom. Left unchecked, these small changes shave confidence, energy, and intimacy from your life. This isn't just embarrassing. It changes relationships. And the clock is real. Losses are gradual and often preventable. There's a practical way to stop and often reverse these trends. It's small, but it works. Urologists and men's health doctors now point to pelvic muscles as one of the few things men can strengthen naturally after 60. They often teach simple exercises before reaching for prescriptions or devices. That's where the shower routine fits. In a moment, I'll tell you about a patient who surprised everyone. Then I'll explain the simple science behind why squeezing one muscle changes the whole system. Finally, I'll teach the exact shower routine and the mistakes to avoid. But not all squeezes are created equal. There's a right way and a common wrong way most men do. This comes from practice at the clinic and studies that show pelvic exercises help erectile function. Stay with me. Under your pelvis is a ring of muscles. They form a kind of sling. They support the bladder, the prostate area, and they help keep erections firm. Think of them as the internal suspenders for blood flow. When those suspenders weaken, blood drains faster and firmness fades. When the pelvic floor contracts, it compresses veins that normally let blood out of the penis. That helps trap blood in and maintain rigidity. So it's not magic. It's basic plumbing. Urologists use the same idea when they check function during exams and treatments. Warm water relaxes muscles. That makes it easier to find the right squeeze. Privacy plus steam equals fewer excuses. Do it in the shower and you'll stick to it. The shower also hides effort. You can practice without anyone knowing. Muscle change comes from consistency. 2 or 3 minutes daily beats a long session once a month. Small daily wins build real strength. That's how pelvic muscles respond too. Clinical programs that succeed focus on short, repeatable habits. Not long, occasional marathons. Meet Bill. He's 68. He used to be active. He loved weekend golf and a good laugh. Over 2 years, his erections softened. He stopped initiating intimacy. He became quieter at home. He was embarrassed to bring it up at his regular checkup. His urologist suggested one twice-daily shower routine. No pills. No devices. No awkward clinic visits. Bill thought the idea was too simple to work. He thought there had to be a catch. 2 months later, his wife noticed a change first. She said he seemed more like himself. He smiled more. He reached for her again. Bill's story surprised even his doctor. It surprised Bill. It felt small, but it mattered. This is not about miracles. It's about rebuilding function a little at a time. I'll share exactly what Bill did after the science section. Hold that thought. First, a quick, simple way to find the right muscle. Try stopping your urine midstream once while you're at the toilet. That squeeze is the muscle you want. Don't make interrupting your stream a habit. That was only for discovery. Once you know the muscle, you'll use the same motion under the shower with better technique. Most men make the same mistakes. They squeeze their butt. They hold their breath. They tighten the belly. That cheats the right muscle. It reduces the benefit. It can feel like failure. The shower helps you feel the difference because you're relaxed. Steam quiets tension. Warmth reveals the right lift. There are 2 kinds of contractions that matter. Short, quick squeezes, and longer holds. Quick squeezes teach the muscle to react when it's needed. Long holds build endurance. Clinical programs that mix both see the best results. That's why the routine you'll learn blends speed and hold. You may have tried Kegels years ago and felt nothing. That's common. Most men do them wrong or stop too soon. Consistency and correct form are the missing pieces. The shower removes two big excuses: privacy and procrastination. It's already part of your day. If you've had recent pelvic surgery, talk to your urologist first. If you feel pain, stop and check in. This is gentle work. It's about training a muscle, not straining it. Soon, I'll give you precise counts and a simple progression you can follow. I'll point out the exact mistakes to avoid. I'll also explain when to see a doctor. For now, remember the essentials. There's a pelvic sling that controls firmness. Warmth helps. Short daily practice beats once in a while effort. Picture this: a tiny set of push-ups for the pelvic ring. That's what you'll do in the shower. Imagine 2 minutes every day. No gadgets. No fuss. Just you and the water. That's where many men quietly rebuild firmness and confidence. Stay with me. I'll tell you the exact routine and the strict form tips that matter. I'll also explain how long it usually takes to notice change. If you want to stop declining and start rebuilding, this simple habit could be our first step. Ready for the routine? It's short. It's private. It's simple. Start with warm water on your lower back. Stand comfortably, feet shoulder width apart. Take a slow breath in. Let it go. Find the muscle by pretending to stop your pee. That little lift is it. Now the exact sequence. Do it twice a day in the shower. Morning and evening works best. Keep it to about 3 minutes each time. Begin with 5 gentle lifts. Quick and easy. Think of them as warm-ups. Next, do 10 quick squeezes. Each one lasts about 1 second. Let the muscle fully relax between squeezes. Then do 5 slow holds. Aim for 5 seconds each. Breathe normally while you hold. Relax your face and shoulders. Finish with 2 longer holds. Try 10 seconds each. If 10 seconds feels too long, start at 5 and add 1 second each week. Rest briefly between each set. If you feel the buttocks clench, release and reset. You want an inward lift, not a push. That's the full routine. It takes about 3 minutes. No equipment. No one needs to know. Start small if you need to. Do fewer reps the first week. Add 1 extra squeeze or a second to the holds each week. Progress slowly. Muscle change is a slow burn, not a sprint. A urologist I know uses this exact plan with older patients. He calls it sensible, private, and repeatable. He's seen men regain firmness and confidence without pills. Some patients report fewer bathroom trips at night too. Why it works in plain language. Picture the pelvic ring as a small drawbridge. When it lifts, the exit routes tighten. Blood stays in the penis longer. That gives better firmness. The warm shower relaxes the rest of the body. That makes it easier to find and train the right muscle. Now a mini story. Bill started this routine skeptical. He did the warm-up and the quick squeezes like I just described. He forgot about it for a few days. Then he made it a rule: 2 minutes in the shower, twice a day. He set a simple goal on his phone. After 4 weeks, he noticed 2 things. He woke up fewer times to pee. His erections felt firmer in the morning. After 8 weeks, his wife said he seemed more present. He told his doctor. His doctor nodded and said the routine matched what he often prescribes first. You may ask, how soon will I notice change? Many men notice small improvements in 4 to 8 weeks. Studies suggest clearer benefits by about 3 months. Everyone is different. Age, health, medications, and past surgery all matter. Let's cover the common mistakes. First, don't squeeze your butt. That cheats the right muscle. Second, don't hold your breath. Breathing helps the muscle work cleanly. Third, don't push down. The motion is an inward lift. Think of pulling up, not pushing out. Another mistake is impatience. Some men try hard for 2 weeks, see small gains, and quit. Muscle training needs time and regularity. 2 minutes a day beats a 2-hour workout once a month. Safety matters. If you've had recent pelvic surgery, especially prostate surgery, check with your doctor first. If you feel pain, stop and call your clinic. If you notice blood in the urine or new symptoms, see a doctor sooner rather than later. A few practical cues help you lock in the right form. Place 1 hand on your lower belly. Don't feel it tighten when you squeeze. If your belly moves, you're using the wrong muscles. Keep your shoulders relaxed. Imagine you're lifting an invisible elevator from below. Breathe out while you lift. Some men feel nothing the first time. That's normal. Steam and warmth make it easier. Keep trying. The muscle is small and often unused. It takes practice to wake it up. You can add a simple tracking trick. Put a small mark on your shower wall with a waterproof sticky note. Each time you finish, move the note one notch along a drawn ladder. In 2 weeks, you'll have a visible streak of consistency. That kind of small victory matters. It builds habit and hope. What about evidence? A number of studies and reviews in urology journals suggest pelvic floor training can improve erectile function and urinary control. Doctors often recommend it before trials of medication. That's not to say it replaces medication when needed. It may reduce reliance on drugs for some men. It may improve outcomes when used alongside other treatments. Here's a common question: can I do more reps for faster results? Not always. More can mean sloppy form. Sloppy form trains the wrong muscles. Better to add 1 or 2 reps a week with correct technique than to do many bad reps every day. Another question: will this help libido? The exercises target muscle control and blood flow. They don't directly change desire. But feeling more confident and spending less time worrying can improve intimacy. That's real and powerful. If you want a tangible goal, try this 12-week plan. Weeks 1-2, follow the routine as written. Weeks 3-6, add 1 quick squeeze to the 10 and add 2 seconds to the long holds. Weeks 7-12, if you feel strong, add a third 10-second hold and try a set of 15 quick squeezes once a day. Keep everything relaxed and controlled. Small wins matter. Track your nights without waking to pee. Note when you feel more confident in the bedroom. Tell your partner something simple like, "I'm working on my health." You don't need to show the routine. You only need to share the effect. Many men worry they're too late. They aren't. Pelvic muscles respond at almost any age. Strength gains happen, and they often translate into better function. Studies show that men in their 60s and 70s can still improve with consistent practice. This routine is the core solution. It's private. It's simple. It's practical. Do it daily in the shower. Be patient. Track small wins. See your doctor when needed. But there's one detail most people miss that can speed results even more. In the next video, I'll reveal that missing detail. It's a tiny tweak that changes how the muscle fires. It surprised Bill. It surprised his doctor too. If you want that tweak, hit subscribe and ring the bell. Try the shower routine for 2 weeks. Come back and tell me what changed. Leave a comment with your wins or struggles. Share this with a friend who might need a quiet boost. This habit can help rebuild more than firmness. It can rebuild confidence. It can rebuild connection. Start today and keep going. In the next video, I'll show the tweak that often doubles results, plus a simple way to measure progress without being awkward. See you there.